Steve, thank you so much for joining me today.
Yeah, you're welcome. Pleasure.
Research has focused on antimicrobial stewardship and infectious disease, and also on artificial intelligence. Can you provide a little bit of your professional background in antimicrobial stewardship and your interest in AI as well?
So I'm trained as an antimicrobial stewardship pharmacist. That's my background, and I had spent 16 years in the world of infectious disease, establishing antimicrobial stewardship program in a variety of hospital settings and health systems prior to joining Wolters Kluwer in 2017. And since I joined Wolters Kluwer, I have been engaging in quite a few projects on collaborating with our data science team on how we can leverage technology to improve the delivery of pharmacist-based patient care interventions to improve and optimize patient outcomes. So through kind of even though my background is on infectious disease and antimicrobial stewardship, a lot of the hands-on experience in the world of AI have been my collaboration projects with a lot of the data scientists, and kind of gain that experience in the past few years and seeing some of the exciting development in terms of what we can do when you put clinicians and technologists together that can derive the biggest benefit for our patients.
Where do we currently see AI being used in healthcare?
That is a loaded question. I will try to address that briefly. In my humble opinion, if you could look at the human body and pathophysiology, the three major areas where we see the biggest promise in terms of AI would be in the prevention, diagnosis, and treatment of diseases. So if you allow me briefly, I will touch on a few of these. For example, prevention, we're getting better and better in understanding what are some risk factors that lead to the development of certain disease states. You know, closer and nearer to my heart, a lot of infections, we have good understanding of what are some of the things that led to an increased risk for developing some of these bacterial or viral infections. So if we can leverage AI to identify these patients earlier, we may have an opportunity to remove some of those risk factors or change people's behaviors that may result in a low risk of infection, if you will. In terms of diagnosis, I'm sure some of you may have heard, even in the general news, a lot of the AI algorithm have now been deployed to read some of the radiology reports, looking at CT scans, stuff like that, to help physicians to augment the clinical decision making, using an AI to see if there's a disease process that they may have missed, or to confirm some of the diagnosis that they have already made. Similar applications of AI can be used in the world of laboratory testing, vital signs, other records that are in the patient's charts, where the technology can help identifying patients with diseases a little bit earlier. So that's kind of where we see AI being applied for the diagnosis part of human diseases being the most promising. Finally, the last part I mentioned, treatment, is another area, right? So if we couldn't prevent and then diagnose the patient with a disease, what people are interested in is what about the treatment that can help the patients recover or manage the disease states. So I think in the world of treatment, we're seeing a lot of the researchers, you know, either academic or in the commercial setting, leveraging AI to help them with drug discovery, looking at new molecular entities and identifying targets or agents that may be of interest that may have promise in terms of accelerating the path into becoming a usable human drug. More closer to the pharmacist's heart, some of these treatments also can have side effects. We're talking a lot about precision medicine these days. I'm sure you may have heard in your line of work. So how can we leverage technology to understand a patient's specific characteristics, such as their organ function, their genomics, and their race, and other characteristics to help identify some of those patients who may be at risk for having adverse outcomes or side effects of some of these treatments. And that may change some of the prescribing decisions. A first-line drug that may be good for you may not be so good for me because of the differences that are inherent between us as two different human beings. So I think using technology has a lot of promise instead of having and I hesitate to use the term cookbook medicine to describe, what is a first-line treatment. The first-line treatment may look different based on the patient individual characteristics.
How can AI be used to identify individuals at risk for contracting COVID-19?
That's a great question. In terms of what we're seeing with COVID-19, I think some of the things that we are learning a lot about the disease since it was first identified at the end of 2019. We're learning the way that it's impacting the human body, and then we're also learning a lot about what treatment works and what treatment doesn't work, right? But I think the greatest area of interest right now is identifying patients who may have been exposed or who may have been at high risk for contracting the virus. We recognize that a significant portion of patients may be asymptomatic, and they don't even know they are carrying the virus, and yet at the same time they can be transmitting the virus to other people who may be more vulnerable or at a higher risk for having complications. So I think some of the technology that we've seen so far, using your phone to identify whether you have been exposed to somebody who might have been identified as a carrier, and that can also facilitate the contact tracing, which is such a buzzword. It warms my heart as the ID specialist that this is a term I know, but now it has become a common lingo in the lay community. So how can we use technology to do this very labor-intensive contact tracing if we could have the ability to actually put in a magical number that said, oh, this person is diagnosed with COVID-19, and then using the technology to roll back the 10 days, 7 days before where the affected individual had interacted with other people, and then notifying them that they might have been exposed so that they can take the proper precautions as well as getting tested. That is very, very exciting and promising. And certainly, we're not just talking about a proof of concept. This type of technology has already been widely applied outside the United States, and we see that recently Europe has reopened, and they have certainly enabled some of this technology in European countries where people can opt in to be notified, as well as opt in when the diagnosis is made to notify the chain of folks that may have been exposed to the infection.
So you mentioned like Bluetooth can be used. Could AI take the form of applications on people's phones for COVID-19?
Yeah, absolutely. Some of the things that we've seen using AI, people can actually be, even without a diagnosis, there's certainly a possibility as people do the searches, right? If you have a headache or you lost taste sensation, we see that people often, what is the first thing you do? Thinking about these symptoms, you probably go to a internet search engine and type in those keywords to look for those things. And I think that can serve as on your mobile devices as using the search history can help at the macro level for local government a better understanding how many people or how many citizens in our locality searching for these terms. So even though we may not be able to test and contact trace 100% of our citizens for this disease, we can leverage some of those searches to help local government agencies to understand how often are the citizens searching for these types of terms. Are we seeing an increase in volume or decrease in volume as a surrogate marker to have a better understanding of the impact of the disease in your local community?
Steve, thanks so much for joining me today and your continued work as well.
Yeah, thanks very much.